right, let's begin with a look at what's happening with COVID-19. Now, over the last couple of days, you must have seen a lot of reports, a lot of stories with the question, are we now going to enter the next wave? We decided to put this to the test. So what has happened so far? A few cases of a new variant of COVID-19 called XE have been found in India, one in Mumbai, one in Gujarat. So these cases have been detected. What do we know about XE? It's a combination of two kinds of variants of Omicron and is believed to be able to spread 10 times faster. Does it have more severe symptoms? There's no clarity on that right now. In the interim, we've also begun our third dose of boosters. So to get a clearer picture, I'm speaking today with Dr. N.K. Arora, who's the chair of the COVID subcommittee of NTAGI. I'm also speaking with Dr. Shahid Jameel, fellow OCIS and Green Templeton College. Welcome to both of you, and thank you so much for speaking with us on the India Development Debate, the denial from INSACOG. Then we've had this opening up of booster doses pretty much over the weekend. Is that in anticipation of a larger spread of the XE variant? Should we be worried?
So thank you very much, Tamanna, for inviting me. I would like to clarify 2 or 3 things. One is that the Mumbai virus, the first round of genomic surveillance suggested it may be XE, but subsequently it was again sequenced at one of the core laboratories of INSACOG network, and where it was found that it is either XJ or XM. And this is true that these X series, it requires many times to confirm with confidence 2 or 3 tests in series, and then only one can be certain. So clearly the first case was not XE. The second case, which has occurred in Gujarat, again, it has been, although initial sequencing suggested it may be XE, but the sample has been sent for deeper analysis. And I think in a day or 2, that result will be available. Now, from a public health point of view, 2 things are important. What happened to these individuals who were picked up to have initial suspected to be XE? Both these individuals had mild fever and they recovered in 2 or 3 days, but they were kept in quarantine. The second, equally important, that extensive contact tracing was done and for both these cases, and there has been no increase in the number of cases. In fact, BMC case occurred in the first week of March, and Gujarat case was in, I think, 12th or 13th of March. And thereafter, it is now almost 4 weeks plus for Gujarat case also, but there is no increase in the cases around that case or clustering of cases. The second point is it was a mild disease. And from again, from the perspective of overall pandemic, neither of the characteristics of rapid infectiousness or spread of the virus was not seen, nor a serious disease, although both the persons concerned were immunized, and which we know that Omicron is a vaccine escapement. So even if those who have received the vaccine, 2 doses of vaccine or even boosters, they have been having infections. Finally, the question you asked about, has this announcement about precaution dose for 18-year plus, was it linked to these isolates? Absolutely no. This issue has been discussed. There were some evidences, and in fact, Shahid is sitting. In fact, in one of his opinion pieces, he also mentioned that this precaution dose should be opened up, but it has been a risk and a risk stratified approach. Maximum risk of hospitalization and death is in 60 plus, and that was started much earlier. Right. Now, below that, because India has a hybrid immunity, we have a lot of natural infection, plus most of the individuals have received at least 1 dose, and more than 84% have now received 2 doses, adults. So the risk is not so much. So it has been kept as optional, but particularly this precaution dose will be useful for those who are immunosuppressed or immunocompromised, which means their immune status is not at the same level as otherwise normal healthy person would have. For example, cancer patients, transplant patients, all those individuals who are on chronic steroids and immunosuppressive drugs, diabetic patients, chronic liver, kidney disorders, they have all compromised immune systems. It will be particularly useful for them and they should go and get the vaccine.
All right. So, Dr. Jameel, great to have you on the show as well. You know, a part of the fears of another wave are also being compounded by what we are hearing and reading about what's happening in China. Can you contextualize this? That is XE creating havoc in other parts of the world, or are some nations now going through the kind of wave we did in January? What is the true picture?
Well, Tamanna, again, thank you for having me. UK, where I am right now, has about 800 reported cases of XE. UK is completely open. There is no legal requirement. Even if you're positive, there's no legal requirement to isolate yourself. So they've opened that much. And I think the reason for that is that if you look at the mortality rates, the mortality rates are almost now approaching that of seasonal flu. And that's happening in several countries in Europe, UK, Germany, France. Although the number of cases, daily cases may be high, but the mortality rates are approaching 0.15, 0.2%. And seasonal flu is 0.1%. So that one has to keep that in context. India, as Narendra just mentioned, has possibly 1 or 2 confirmed cases. And I don't think the old saying that one swallow doesn't make a spring, it goes here too. Let's not worry too much about 1 or 2 cases here and there. I think what is critical is to see whether there is a rapid increase in cases. And in India, there is no evidence for it. And as Dr. Arora just outlined, possibly the reason for that is that India has vaccinated very well. India's adult population is vaccinated very well. And India has also suffered a lot of infection during early waves. So it's this hybrid immunity that's going to continue to protect people from disease. We may have increased number of cases in future. And already, I think some states, the government has put out an advisory to a few states saying that you should keep a watch. But by and large, I feel that because of these reasons, India is going to be protected from severe disease in the days to come. So let's not worry about it. Virus mutations happen all the time. Variations happen all the time. That is not important. What is important is whether one particular variant has any distinct growth advantage.
Okay.
And at least UK, where you have 800 cases, the latest UK HSA report says that they're not sure whether XE even has a growth advantage over existing strains.
So let me come back to the Indian context, Dr. Arora. And I think some of these fears also come from a sense of deja vu, right? Because we had similar conversations before Omicron. We have great inbuilt immunity. There's been a widespread of the disease. We're better suited to deal with it. The cases weren't increasing rapidly first, and then they suddenly shot up. What I'm trying to understand is that could one of the reasons for less cases being reported also be that people are simply not testing as much? And those who are also now have access to rapid tests, which don't really get recorded anywhere. So is that a loophole where, NTAGI, for example, or INSACOG, for example, is taking into consideration that you may not have data as accurate as in the past because of these factors?
So you are raising very legitimate questions. So the system has been built that true, as we move forward and we find illness is very mild, it's like a common cold, and less people will come forward, specifically for the testing. So the state governments at all levels, that means district hospital, community health centers, primary health centers, and sub centers, a minimum number of people who come with these symptoms are being tested. So these days, around 7 to 8 lakh tests are being done to maintain that the uh, that the issue which you are raising, that maybe because people are not getting tested. So as you can see, 7 to 8 lakh tests are being done, and we are getting around 1,000 positive. Another very heartening finding we have, that India has started sewage sampling, and in some of these places where there are no cases, this sewage is also not showing any virus. Now, which is a very good indicator that whatever cases we are finding in human beings in that place, occasional here and there, because sewage picks up even the asymptomatic individuals who are infected but do not get symptoms. So there is seems to be good correlation between sewage results and what we are seeing it on this a structured testing framework which we have at the moment in the country. You asked a very important question, and Shahid raised this issue that in 5, 6 states we have some increase during last 1 week or 10 days, 30, 40% cases. On a daily basis, it may not look too much, but at a weekly basis, it looks more. And there are two or three things. One is these are not clustered cases. Again, so if there was a particular variant or something, they are being mapped out on the wherever they are occurring, and to see if there is clustering. So there is no clustering occurring. The second is, in recent times, some of the states have also asked that now mask is not mandatory, kind of thing. So it appears that there may be general lowering of the guard. Particularly, I think we Indians are had kind of restrained ourselves from social gatherings, marriages, and birthday parties, and all those kind of social and religious get-togethers. And that may also be the reason that if there is a lowering of guard and greater mixing is taking place. But having said that, INSACOG system is very much on the alert. We are looking for any kind of abnormal rise of cases in a particular place, or whatever these cases are occurring, which are in the first go are being reported as XC or any of the X case, series cases, they need to be reconfirmed. Here I will recall another point, and that is after Delta, we had a lot of hue and cry and panic because of Delta Plus. They were AY series, but again, they kind of over the time withered away without any difficulty. This time we have X series, and X series has 12, 13, 14, and every day a new variant is coming up. And biologically, these viruses, Omicron subviruses, BA1, BA2, BA3, they have breakpoints. They break and they stick on to the other variant, and new variant comes up. So it looks overall, it is nothing to be worried about, but public health vigilance, genomic surveillance vigilance is to be maintained. And COVID is very much around us. We cannot be lowering our guard, and we need to maintain vigil at all levels, including corona appropriate behavior.
All right. Thank you so much, Dr. Arora, Dr. Jameel, for joining us today and reassuring us and our viewers that there is nothing really to be worried about right now as far as XE is concerned. Of course, we have to keep watching this space. Thank you.
Thank you.
All right. The big story that we're tracking this evening on the show.